Huge changes are coming to Medicare Advantage plans in 2026. You've probably heard by now a really big insurance company is canceling a number of Medicare Advantage plans that cover over 600,000 people. That was announced at the end of July, but they're not alone. Estimates show that over 1 million people could lose their Medicare Advantage coverage. According to a brand new study by the Kaiser Family Foundation, more than 34 million Americans are enrolled in Medicare Advantage plans. That's over 50% of all Medicare beneficiaries. Just look at how Advantage plans have exploded since 2007. So insurance companies across the country, from the biggest players to the smallest providers, are pulling hundreds of Medicare Advantage plans off the market for 2026. The current estimate is that more than 1 million people will lose their existing plan starting January 1st, 2026. And most of those cuts will target PPO-style Advantage plans, which offer more flexibility to access doctors and out-of-network benefits, but also cost the insurers a lot more to provide. Rising medical costs, reduced government payments from the Inflation Reduction Act, and of course the need to become more profitable are putting stress on the insurers. So no surprise they're exiting unprofitable plans affecting over 1 million Americans. Finance expert Kevin Thompson recently said, "Insurers are finding it difficult to offer the same plans when reimbursement rates do not cover the increased cost of care." So why are they doing this? Well, Medicare Advantage plans are private health insurance plans paid by the federal government to provide Medicare-covered benefits for a lower premium as an alternative to more traditional Medicare. While people on traditional Medicare have access to any doctor or hospital that accepts Medicare, Advantage plan participants can only access providers that are within their network, and doctor and hospital participation can change throughout the United States. The majority of Advantage plans cover Part A, Part B, and 89% of them cover Part D prescription drugs as of 2024. Some of these plans also cover gym memberships, meal delivery services, acupuncture, or even caregiver support. That's quite different from traditional Medicare that doesn't typically cover those things or prescription drugs. Part D prescription drug coverage is offered as an option for traditional Medicare entirely through private plans. On average, as of 2024 figures, insurers receive roughly $1,105 per member per month of premiums, or about $13,260 a year. And according to the Center for Medicare and Medicaid Services, they have to spend at least 80 or 85% of that on medical care, prescription drugs, or quality of care initiatives. That's called the medical loss ratio and only leaves a small amount left over to make a profit. In recent years, three things have squeezed those margins even tighter. First, healthcare costs in the U.S. are rising faster than inflation. No surprise there. Second, people are using more care and more expensive care than ever before. And third, the Inflation Reduction Act shifted more prescription drug costs onto insurers starting in 2025. Many companies priced their plans before these changes fully hit. So by 2025, they were losing money. And because insurers can't change pricing mid-year, their only option is to cut off unprofitable plans moving forward. So that's what's happening now. You know what's really big? If your plan is being eliminated, they don't just move you onto a new plan. That means if you do nothing, you'll be left with original Medicare only and no prescription drug coverage on January 1st, 2026. If you are dropped, you have to actually choose another plan. And that could leave more than 1 million people without their current coverage. If you're on Medicare Advantage, you need to know what's happening, why it's happening, and most importantly, what you can do about it. This year will be extremely important to read your ANOC letter. The annual Notice of Change letter is typically sent in September each year to inform you of your coverage, the costs, and the benefits for the upcoming year. This provides crucial information for deciding whether to keep your plan or to switch during the annual enrollment period from October 15th through December 7th. You'll most likely get multiple notices in the mail if your coverage is being dropped, and probably phone calls from insurers urging you to stay with them on a different plan. But unless you actually select a plan during the fall enrollment window, you risk having a significant gap in your coverage. This is really important. The three largest expenses for many retirees are taxes, housing, and healthcare. Understanding and managing your healthcare costs is a key part of retirement planning success. Now, even if your plan isn't being eliminated, you'll likely see some changes in 2026. Some plans may now require referrals before you can see a specialist. Others may tie you to a specific hospital group. In-home health reviews may become more common. Deductibles for certain surgeries may appear. Plans that used to cost $0 a month may add premiums, or existing premiums may increase. These are all ways that insurers manage their costs while still staying competitive. And it's a lot to understand in order to make a good decision. That's why it's important to read and understand your annual ANOC letter. But what about the other plans available? How do you compare? And how do you know which one to choose? Well, this episode on the channel is sponsored by Chapter. I'm partnering with Chapter because Medicare costs are through the roof. Millions of retirees are on the wrong plan, and I needed a company that I could trust to help my clients navigate Medicare. Look, the average couple will pay over $300,000 in Medicare and healthcare expenses during retirement. Good planning can minimize these costs. The founders at Chapter recognize this. On average, retirees working with Chapter to choose their Medicare plans saved $1,100 a year. Chapter helps you stay in network with your preferred doctors and is the only national Medicare advisor that compares every available plan so you can be sure you're seeing all your options, not just a select few a broker is paid to push. You know what's different from a typical insurance broker? They're completely independent Medicare advisors paid on salary, not a commission for selling you the wrong plan. And even better, there is no obligation. When you call this number, you will speak with a real human in the US who will walk you through your options in under 20 minutes. So give them a call at 818-924-2041 or visit askchapter.org/CWM to get the best plan for you, and let me know about your experience down in the comments. All right, what if your Advantage plan is discontinued? What do? Well, you have two main options. First, you can choose another Advantage plan, either with the same company or with a different insurer. And this is what most people with Advantage plans do, especially if supplement plans are too expensive. But you need to act by December 31st, 2025 if you want coverage starting January 1, 2026. The second option is unique. When your Advantage plan is pulled from the market, you get what's called a guaranteed issue right to switch back to original Medicare and add a Medigap supplement plan without any medical underwriting. That means that you can't be denied coverage based on your health. Normally this option is very limited, so losing your Advantage plan can actually open up a door that isn't usually available, especially if you have underlying conditions. Now, normally the annual enrollment period runs from October 15th to December 7th. But if your Advantage plan is being eliminated, you have until December 31st to choose a new plan without losing your coverage. Your window to use guaranteed issue rights for a Medigap plan runs from 60 days before your plan ends to 63 days after. If you want continuous coverage, make your decision before December 31st. One tricky detail is that in many states, insurance companies do not pay agents commissions for helping clients use their guaranteed issue rights. That means that some brokers may not take on new clients who've been dropped from their Medicare Advantage plan. In this situation, simply because the workload is high and there's no compensation, it doesn't make sense for them to take on a new client. In states where laws require compensation or where insurers choose to pay, it's a lot easier to get help. If you live in a state that doesn't compensate, you may need to be prepared to navigate more of the process yourself, or give Chapter a call since their agents are salaried and don't work on commission. The bottom line, millions of Americans rely on Medicare Advantage. In fact, more than 34 million. But big changes are on the horizon in 2026. If your plan is being eliminated, doing nothing could leave you with original Medicare only and no drug coverage. You need to take action, whether that means moving to another Advantage plan or using your guaranteed issue rights to switch to a Medigap plan. Be aware of the deadlines, understand the changes, and decide who you want to get help from. This isn't about whether Medicare Advantage is good or bad. It's about being prepared so you're not left without coverage. Now, if you found this video helpful, share it with friends or family on Medicare Advantage so they aren't caught off guard. And look, I don't sell health insurance plans. That's not my job. But as a certified financial planner, helping people know their options is my job. Healthcare is one of your largest retirement expenses, so make sure you have the best plan for your situation. And if you own a business and are interested in optimizing your retirement planning, you can get started working with me today by visiting celestialwm.com and clicking the Start Here tab to schedule an initial call. Still not sure that you want to talk? Well, head over to my resource center and learn more about my financial planning process by watching my 35-minute complimentary training. And check out this video next for even more ways to supercharge your net worth.